Morning everybody, Dr. Eric here. Just a quick video about cravings. I get a lot of patients and clients who ask me about cravings, food cravings, sugar cravings. We're not going to talk about some of the other cravings, but the bad vices, right? How do we curb that? A lot of people are craving that salt, craving that sugar, things like that. So I'm going to just give you a few, little bit of background on this and a few quick tips about how to control this, because as we know, as part of all of us who are trying to maintain a healthy lifestyle, reduce that inflammation, lose weight, feel healthier, feel stronger, gain more energy. There's many strategies that can help, and of course, giving into these cravings and eating those simple carbs and sugars and yummy desserts and things like that is definitely going to derail that. So we're going to talk about carb cravings. Specifically, we'll talk about salt cravings in another video. So carb cravings, numerous causes. The biggest one, of course, just as with most things, is lifestyle, especially stress. When our stress is ramped up, when we're burning the candle at both ends, when we're working, running, and not getting enough sleep, just wired and just going all the time, that can derail many things, not only mentally, physically, and psychologically. That alone can increase cravings. A lot of people tend to resort to emotional eating or feeling like they need to do something to calm that down, which usually when they eat a sugar or something like that, it kicks up a spike in dopamine and makes that feel-good chemical in the brain, which also activates the reward centers in the brain, the amygdala and the hippocampus and other parts of the brain that can trigger that urge to do it again, and it's a vicious cycle. So lifestyle is one of the biggest one. When you're stressed all the time, your cortisol levels get too high, and as we talked about in other videos, when they're chronically elevated, again, that promotes that response of feeling like getting the blood sugar dysregulation, causes other hormonal responses in the body and the brain to throw everything out of whack. Your cortisol, if it's too high for too much, it'll increase those cravings for salt, for sugar, for just to eat in general. It can decrease your production of thyroid hormone, of sex hormone binding globulin, and testosterone, estrogen, DHA, all the beneficial hormones. Basically decrease the anabolic or hormones, those that build up your body, make yourself stronger and leaner, and increases the bad ones, which of course unfortunately promotes weight gain and fatigue and etc. So cortisol is related to stress and all of the other hormonal cascades as well. Sleep is a big one too. Again, it ties into stress. If you're not sleeping, studies have clearly shown that those people with less than even 5 or 6 hours of sleep, sometimes less than 7, will definitely have increased cortisol levels, increased cravings, poor function in work and in the gym. Relationships and work-life balance plays right into that. Again, it's all about, if you're fighting with your spouse all the time, with your kids constantly every single day, again, not only the stressful component as we talked about, but also the psychological component too. Insulin resistance and poor diet and dopamine dysregulation also play into cravings. Dopamine dysregulation we touched on briefly. So when there's a lack of drive, you're depressed, you're apathetic, you sometimes have some impulsiveness, fatigue, lack of focus. Again, those cravings. Just can't seem to finish tasks that you start, sometimes poor libido. These are some signs of, amongst other things, dopamine dysregulation obviously can be signs of other issues too. But when you're eating a poor diet of a lot of processed foods, a lot of simple sugars, fats, French fries and donuts and things out of a box, all the things that tell you not to eat, this plays into that and just not only can cause the insulin resistance, which again feeds into the cortisol dysregulation and the hormonal dysregulation, but again can feed that urge for those cravings for those simple sugars. We'll talk about how to fix that, here shortly. Hypothalamic, pituitary, adrenal, and gonadal axis dysfunction and deficiencies can definitely cause cravings as well. We talked about cravings from cortisol. Cortisol can also affect your gut, your GI tract, inflammation, depression, pain can be results of this as well. So if you have a hormonal deficiency, whether it's from the chemicals or from age or head injury, concussions, things like this, if your DHEA, estrogen, testosterone, growth hormone, all these are off, thyroid is off, it can definitely play into this as well by affecting all of the other hormones. Again, they're all interconnected like dominoes, and one thing goes, sometimes another one falls as well, so they're all interconnected. Dehydration is a very common cause. A lot of people think that, oh my gosh, I'm hungry, when you're actually really just thirsty and dehydrated. This is very common. I experienced this back in my wrestling days, and I hear this with athletes a lot. Sometimes just a small amount of dehydration can kick that off and feel like they kick off that urge. Your body's telling you to put something in your body, but it's really just telling you to put in electrolytes and fluids. And sometimes when you just drink a big 8-ounce glass of water, maybe with a pinch of sea salt or a little bit of lemon juice or just some water, you'll feel better and you won't have that craving anymore. A lot of people mistake hunger for thirst. So A simple rule of thumb is just look, if you're peeing and it's clear or almost clear, just a very tinge of yellow, that's where you want to be all day long. That's a simple monitor throughout the day. If you're not peeing very often or it's very dark yellow in color, you need more fluids, especially around the time of the workout, but definitely all day long. There's many ways to guesstimate fluid intake, things like that, 2/3 your body weight in ounces, things like that. But the best way is just monitor your urine. I know it's gross, but follow, check the toilet bowl and see how it's looking. Gut infections are a less known, but also a very common issue that can cause cravings. So if you're having a lot of bloat, GI discomfort, achiness all over, tired, and again, this is something else that would clue you in and to clue in your doctor to talk to you about gut infections. Because if there's a gut infection, it's a whole other topic, but it can derail your digestion, of course, weight loss, increased cravings, fatigue, inflammation, joint pains, all of these things as well. And that's something that has to be dealt with by not only a clinical exam by your physician, but often can need some additional testing as well, something that I can help you with, or I can help your physician with, or your physician might already know how to do this. So nutritional deficiencies, chromium, B vitamins, magnesium, iron, many others, vitamin D. A lot of people just don't get enough of the essential micronutrients if they're eating a poor diet, high in processed foods and seed oils, not enough fruits and vegetables, healthy fats, or they're just not eating enough because, again, stress and poor lifestyle. These nutritional deficiencies can definitely cause cravings, specifically for sugar cravings. So how do we fix this? Strategies. We're going to talk about strategies. We could talk for hours about this, but the basics are like what I always preach: a whole food diet. Eliminate the processed foods and get rid of the simple sugars, the seed oils, anything that comes in a box or a bag or it's fried, generally is not good for you. Get rid of the excess sugar, the excess fructose, whole foods, fruits and vegetables, healthy fats, lean protein, organically raised preferably, is definitely the way to go. Lots of fluids. So if you just stick with the whole food diet, that alone will help, because not only for eliminating those nutritional deficiencies, but it'll keep your blood sugar stable throughout the day, so you won't get those spikes in insulin and glucose to prompt you to want to eat. It's going to make you feel full longer. If you're eating enough protein, enough healthy fats, enough healthy carbs, you're going to feel full longer. You're not going to be hungry. You're not going to be, and you're going to be satisfied. Because if you eat the right foods, yes, healthy food can taste very good and be very satiating. And if you eat the right things, some oils, some spices, you're going to feel very satisfied. It's going to be very pleasing to the palate. So a lot of people think that, oh my gosh, healthy foods taste yucky and boring. And it can be, but not if you do it the right way. It can taste very, very good and kill that craving, as well as fill you up longer. Another strategies, again, like we talked about, hydration, adding a little bit of pinch of sea salt to your water when you're drinking throughout the day. Organic acids like apple cider vinegar, lemon juice, which I just mentioned, things like that can also help, not only with insulin sensitivity, but also with those cravings. Do a little bit with your salad, or maybe right before you eat a meal. It will help you process those sugars appropriately, improve that insulin sensitivity, as well as eliminate those cravings. Sunlight exposure is fantastic. I know it's hard during the winter, but whenever you can, some people get the red lights, Juve lights, UV radiation, the little lamps, or just get outside as much as you can for 15, 10, 20, 30 minutes a day. Get that sunlight exposure. Not only helps with your mood, helps with dopamine, helps with vitamin D production, but can help with that as well. We touched on making sure you're getting adequate sleep and minimizing stress. Take some time for daily meditation. I'm a big fan of meditation, or at least some deep breathing, something you can do for at least 5 to 15 to 30 minutes a day to chill you out and relax. I'm a big fan of meditation, even if you're just sitting in a quiet room, breathing, count to 5, with a deep belly breath in and hold it, and then breathe out. See my other videos on this, but daily meditation, relaxation exercises, yoga, tai chi, simple walking is key. Make sure you're getting enough sleep. 7-8 hours of sleep is usually good for most people. And again, we talked about other strategies to maximize sleep in other videos. So sleep is key. Again, exercise, of course, is part of lifestyle. Regular exercise is going to help. It's going to help in many ways. If exercise was a pill, it'd be marketed all over the place. So the benefits, of course, will help mitigate stress and lower that cortisol level, help your insulin sensitivity, eliminate those cravings. Next one is, of course, we talked about water and electrolytes. Fasting is another great strategy to improve insulin sensitivity and to reduce cravings as well. Again, see my other videos and blog posts about this. Many ways to do this, but simple time-restricted eating or intermittent fasting is a very simple way to ease into it. Start with 12 hours a day, maybe go up to 14 to 16. Some people can do 24-hour fast. Not always necessary, but you're going to be sleeping through most of it, and that will definitely help reset the gut, heal the gut, and help with those cravings and settle things down internally. Supplementation, not always necessary. There are some things that can help with that, but some simple things like bone broth can provide those essential amino acids and heal the gut, improve any hormonal, in terms of gut dysregulation. One of my favorites is dark chocolate, the healthy kind, not the kind loaded with the sugar sweeteners and all the stuff. It really has to be just cocoa or dark chocolate, as much as close to 100% as you can. It's not super sweet, but man, you take off a square or two of that and just nibble on there, let it just dissolve on your tongue, and that will eliminate any sugar cravings you may have. Or just make a cup of hot cocoa. Again, the good cocoa. Again, it's not sweet, super sweet, but it will kill that craving, and it works very, very well. Try it. We talked about apple cider vinegar and adding cinnamon and things like that to your dishes, helpful, but I think the dark cocoa and the dark chocolate is amazing. Will definitely help with any carb cravings, especially in the evening. In the evening time is a great time to have that carb, but make it a healthy carb. And then that will promote sleep and also eliminate any cravings that you may have. A sweet potato, some clean white rice, a piece of Ezekiel bread or a yam, anything like that, totally fine, especially if it's post-workout. Don't be afraid of that, but you don't want to be eating the boxes of a sugary granola, a box cereal, and things like that. So the last couple things are testing. We talked about testing for hormonal deficiencies and gut infections. That's where an age management physician or a functional medicine doctor or even your private doctor can help you with that. I do this all the time, fixing those hormonal deficiencies, looking for gut infections. This will help heal the gut and help eliminate those cravings. So just some quick tips on how to eliminate those sugar cravings. Hope this is helpful. If you have any questions, please comment or reach out to me. Look forward to talking to you guys soon. Everyone live great. Dr. Eric, have a great day.